Good evening and welcome. I am Cassie Parham, the Assistant Superintendent of Education Services for the Irvine Unified School District. Ed Services oversees the district schools and educational programs, which include curriculum and instruction and student support services. My team is responsible for ensuring that all of our students receive the highest quality educational experience we can envision and the support they need to be successful in college, career, and life. I would like to thank UCI for hosting this event and the panelists for lending their time and expertise in addressing parental concerns. UCI has always been an incredibly valuable partner, and as a former anteater, I truly appreciate the resources they invest in their students and in their community. Please know that in addition to the live stream, the forum is being recorded and it will be available on the IUSD website. Our panelists today will be responding to questions generated by IUSD parents and sharing their expert recommendations for supporting students, including how to reach out to students, how to identify signs of distress, and when and where to seek additional support. We know that growing up is so challenging, and helping our kids find their way has never been simple. However, the isolation and fear generated by the COVID-19 pandemic, coupled with the comparison trap of social media, have ushered in new stressors, causing an alarming uptick in child-adolescent anxiety and depression, and creating problems never experienced by previous generations. Therefore, I am so excited to have this opportunity to hear from our resident experts, beginning with our moderator, Dr. Ramal Berra. Dr. Berra is a clinical professor of psychiatry at the UCI Irvine Department of Psychiatry in the School of Medicine. He's lectured extensively about major mental illnesses and the latest treatments in the US, Canada, Europe, and Asia. And he works regularly with physicians of all specialties to incorporate mental health evaluations and treatments into their practices. Please join me in welcoming Dr. Berra.
Thank you so much, Cassie, for that introduction. I'm very excited to serve as your moderator for this really important forum that the joint partnership of the University of California, Irvine and the Irvine Unified School District have put together. As a close to lifelong resident of Irvine, whenever I think of the city of Irvine, the two things that come to the forefront are the University of California, Irvine and the Irvine Unified School District. I see those two entities as the foundation of this city, so I'm excited to serve as a moderator. As far as the Irvine Unified School District, without question, this is a school district that the country looks at as a model. What takes place here, other school districts have an ear. How are we approaching mental illness? How are we taking care of our kids? How do we continue the maturation and growth of our students who graduate and, go out to the world and we hope become leaders and important in whatever area of work that they eventually decide to pursue. As I said, on a personal level, I've been at UC Irvine really since I first started college back in 1979. Both of my kids went through schooling in Irvine, K through 12, and the foundation that they got from their teachers, their peers in the Irvine Unified School District really led to what they've decided to pursue in their career. So, both institutions are very close to my heart. Now, today's forum, created jointly between IUSD and UCI, is really to provide support to parents in these very challenging times, as Cassie had mentioned. Mental health has always been a difficult area to address, not just as schools, as teachers, but even at the dinner table, with your children. But I think we can no longer avoid that. It's critical that both, schools and parents, become more comfortable addressing these challenging issues. We hope tonight our job as parents is really to protect our children from adversity, do our best to promote their well-being, but that's not an easy task. We've got a great group of esteemed panelists tonight that really are experts in these areas, and I believe, in the next 45 minutes, we're all going to get some tools to how to address these challenges. So with that, let me introduce our esteemed panel. I'll start with Dr. Premjit Joshi. She's my boss. She's the professor and interim chair of the Department of Psychiatry and Human Behavior at the University of California, Irvine. And she's past president of the American College of Adolescent Psychiatry, really the entity that oversees putting together ideas, concepts on how to approach mental illness in children and adolescents. Dr. Marcel Hayashida, also from UCI, she's the Associate Vice Chancellor of Wellness, Health, and Counseling Services at the University of California, Irvine. And then from the Irvine Unified School District, we have Sunny Shen. She's the Director of Prevention and Intervention in the Irvine Unified School District, where she oversees the work of mental health and behavioral and academic interventions across the entire school district. And finally, we have Dr. Tammy Blakely. She's worked for many, many years, over 30 years, in K through 12 education, working in counseling, child welfare, attendance, crisis response, and threat assessment. So we've got a perfect panel to address the many questions that came forward from all of you. And I really want to thank all of you for signing up for this virtual forum. So we've had dozens and dozens of questions that have come forward from all of you as parents. And I'm going to do my best to summarize them and really direct them to our experts here. So I thought we'd first start with, both Sunny and Tammy, addressing some questions that I'm sure are at the forefront of all of your minds. So maybe I'll start, Tammy. What has the Irvine Unified School District done to respond to this increased need for youth mental health support? How has the school adjusted to this demand?
Thank you for the opportunity to answer that question. Student mental health has been a priority within IUSD for many years, going back 6-7 years when we started to put into place support staff at school sites. So we're looking at elementary resource counselors at elementary schools. We were looking at mental health specialists at secondary schools, school counselors that are able to do that universal support for students. We recognized with the pandemic and in response to the increased student mental health needs, we've increased that staffing, so increased elementary resource counselors, mental health staff, increased school counselors, and we know that that is to provide that individual and therapeutic support for students. We also have prevention programs that we've been implementing through the school sites. It is the Speak Up We Care program, which is really encouraging students to have trusted adults on school grounds. It's that their voice matters and that we are listening to them. If they will use their voice and let us know what's happening, that we will get them connected to supports and services. It is the Say Something app, which is the anonymous reporting system that if friends or other people see that there's concerning behavior with students, that they have the ability and the platform to let other people know. And that platform goes directly to the school sites and to the district office to make sure that we have the ability and a way to respond to the students' concerns, and we respond to that. We have Care Solace, which is the third-party supports in mental health that can be for students, for staff, or families to say, we need mental health supports that may be outside of the school site, and we get them connected with warm handoffs. We also have the Hope Squad. I would be remiss if I didn't mention that. That really is peer-to-peer supports in suicide prevention at high schools predominantly, and we're moving that into middle schools. And finally, we've got SEL screeners, which are new. We're piloting those, and we're bringing those to where that is our way of being able to check in with students, find out how they're doing, and really be able to assess if there are students that need more supports to get them connected to those supports. So thank you very much for that opportunity.
Yeah, the full scope.
The full scope.
Have you seen an uptick in parents, students accessing those services?
We really have, and that we were responding to our annual survey that said they want increased supports, and so we've done everything that we can, leveraging the resources that we have to make sure that we have those mental health supports in place, and we're increasing and expanding as much as possible.
Okay, excellent, thank you. And Sunny, from your end, in your role, really being on the front line and, you know, hearing from every school in our district, what are some of the signs that a parent could get a sense that my child may be struggling?
At the school site level, we'll look at a variety of, we call them data points or factors that students are engaging in, whether it's school attendance, interest in peer relationships, academic performance, and at the home level, those are the things that parents can be looking out for as well. I think I would recommend initially that parents understand the baseline of student interest, how they're doing in school, who their friends are, so that they're continuing to engage in conversations as they change developmentally. I've worked in elementary through high schools, and their interests will naturally change, and their personalities will change. But I think having a good pulse on what are those interests, who are your friends. I would recommend even engaging with the parents of your child's friends, knowing their coaches. There are people who see their children in different lights, or they might communicate a little differently. There are children who are very verbal and externalizing, and you have no problem knowing how your children are if you have children like that. And you might have more internalizing children who tend to keep to themselves, don't share a lot of their thoughts and feelings, but they hopefully are sharing with somebody. So I think the more a parent is able to invest in that time to say, are their interests changing? Is their motivation starting to wane in a certain area? Is that just a natural byproduct? Should I engage them in something else? And then just seeing if there are certain patterns, if there are things that they used to really enjoy in school but they're no longer enjoying. Are they, and I know there are some more clinical signs to look out for, but from a school perspective, I think partnering with a school too, because the school is always looking out for those data points. And when we're seeing certain red flags go up, so to speak, through those indicators, we'll connect with the teachers. Teachers will connect with parents, but I think a parent being proactive in that communication is always helpful as well.
Okay.
I think Dr. Hayashida had some.
Yes, Sunny, you mentioned some clinical signs. Dr. Hayashida, Dr. Joshi, what might be some of the clinical signs in children and adolescents?
Yeah, I'll start with a few. I think you had some fantastic examples of lack of interest in activities. I would say, I would add sleeping more or less than usual, eating more or less than usual, crying more than usual. Again, some students internalize it, and so they're in their rooms, and you wouldn't necessarily know. Other students are going to be more verbal, or maybe angry or aggressive, or may take things out on siblings. And so you're looking for changes in behavior. And I wanted to say, too, with teenagers, emotions change. On a Monday, the kid could be happy. On a Friday, they didn't do well on a test and they're sad, right? There's some normal changes and fluctuations that are expected, that are developmentally appropriate. And so we're not going to zoom in and save the day if they're sad, appropriately sad after something sad happened. But we're looking for the duration of the sadness. Can they shake themselves out of it? Do they have some coping skills? We're looking for those sorts of things to see if there may be a more clinical problem.
Dr. Joshi?
So you made some wonderful points, and thank you for including me. This is really exciting, this partnership between UCI and the Irvine Unified School District. So when I look at adolescents, I always look at three spheres. There's the family sphere, there's the school sphere, and then there's the social sphere. And we know, for the most part, you know, what the norm is, and I think you all had pointed out, we're looking for a change from the norm. And I think you had mentioned earlier, there's kids who externalize. Those we see. You know, teachers will notice changes because they're acting out, or they're being, you know, more loud, or they're just being difficult. It's the kids who internalize. You know, these are the more anxious, shy, perhaps sad kids. And we don't tend to see it till it's much further along, and then it's a little harder to kind of rein them back. And so those are the quiet, shy, normally, you know, some of us just happen to be a little introverted, and that's okay. We happen to be a little shy, but that's when there's a change, and that is a little more worrisome. So the squeaky kid will get everyone's attention, but it's the quiet kid that doesn't. And so we really have to kind of know our kids well enough to know that, you know, there's a change from what the norm is. But that's what I would say, yes.
Yeah, that all, what you've all described, sort of leads to this next question. That was a common theme, you know, in the questions that came forward. So you've identified changes in the child from, let's say, their norm, whatever that norm might be. How do you begin that conversation and communicate with your child when you've seen a change, or you've heard of a change from a parent or one of their friends? How, as a parent, can you start that conversation, which is often, and I'm even in myself as a professional in mental health, that is often the most difficult, you know, how do I begin that? So, you know, maybe Tammy and Sunny, do you want to share some thoughts? And
I would say, even if your child is showing you on the surface that they don't want to engage with you, that maybe they're not as keen in talking with you as much as when they were younger, they still have a deep desire to be understood and seen and known by their parents on a certain level. And the challenges as a parent, as they're going through those upper elementary, middle, high school years, of how do you get them to engage with you in conversations in a way that is you know, they're sharing a little bit more about themselves. And I think as a parent, they're taking that stance of, when they're little, you're doing so much to instruct them, right? You're their first teacher. And then at a certain point, you're becoming more of their coach and asking maybe more open-ended questions, offering guidance instead of being the ones who are giving them the clear answers of what to do. But as a parent, that's a difficult shift to make, because you're used to being successful in a certain way, but needing to adapt with your child. And so I would encourage just open-ended questions. I think, you know, there's research that shows the importance of having dinner together when you can, as much as you can, and just those unstructured moments where you're able to ask open-ended questions. You know, in my household, we call them peaks and pits, where they're offering like a very high of their day or a low. You might not get much, but when the moment is right, you might get quite a bit. And so I think, you know, offering those open-ended questions, and then offering just even more questions to follow up instead of jumping to providing those answers. I give answers all day long, but when I go home, I have to really put a pivot on what I do when I choose to engage. I have late teens and early adults as well. And so I would just say that kind of communication starter is nice.
other thoughts?
You know,
Dr.
just to
Joshi?
piggyback on that, it's kind of, you know, saying to your child, we need to have a conversation. It's not going to go very far. You know? So it's just being available for them. And it can happen, you know, while you're driving them to school. It can happen when you're just sitting around the dining table. You're watching a movie together, or you're doing something together as a family. So just being available and kind of keeping your ears open a little bit. Sometimes you'll hear something from a friend. Let's say you're carpooling and there's another friend. Pay attention to the conversation that's going on in the back seat. You know, so it's all these things that you kind of pick up on, and cues that you pick up on. Or the sibling might come to you, you know, younger child or older child. You know, something is, you know, mom and dad, so-and-so, you know, some inkling. And so that, because the siblings know their siblings pretty well, you know, so, or an extended family member, or, you know, so you just have to just be, when that opportunity presents itself, take it.
Yeah.
To add one thing, I did bring a prop. And so I want to share this resource. It's called The Emotional Lives of Teenagers, Raising Connected, Capable, and Compassionate Adolescents by Dr. Lisa D'Amour. We're in the same grad school around the same time, so I'm a fan. And she says many of the same things that you were talking about, but that sometimes teenagers will want to do something right before bed, when you are in bed, getting ready, turning off whatever, winding down, and that's the moment when they say, oh, and by the way, I'm not doing well in this class, or by the way, this awful thing happened yesterday, right? And that, it can drive parents a little, batty, but it's for a reason. It's because they can control the narrative. They know you're getting ready to go to bed, you've got 5 or 10 minutes. It's a safe time where they know it's not the beginning of the day, and so they're going to hear about this for the rest of the afternoon. They also tend to say things in cars, right? So when you are not face-to-face, but when you're side by side, they can tell you things that are delicate without having to look you in the face.
As long as you don't drive off the...
So you can have a conversation that's time-limited, right? That's comfortable for them, where you're not facing each other. And sometimes these are nice and comfortable ways for students to express something to you that they wouldn't ordinarily want to do when they felt put on the spot. So a couple tips for the book.
I was so interested as I was hearing this. It doesn't end when they graduate from the IUSD. My kids are 30 and 27, the exact same thing. It becomes fun as you become a partner with your kids as they go older. And I tell my kids, ask us how we're doing. This is not a one-way street. And I think it can begin even in elementary school, middle school, getting the kids engaged with seeing how their parents are doing. And it becomes fun. I mean, and that's where you really learn, that what you've done and how you've raised your kids.
And grandparents play a big role. So I'm a grandmother of 5.
Yeah.
And so I have 2 grown sons in their late 40s. And so they'll come to me and say, oh, Vikram is my grandson. I think he needs to chat with you, Mom.
There you go. Yeah.
And so, there's a way to sort of be part of that conversation, and you just pay attention to that. Because sometimes the parents themselves perhaps don't want to take that step, but one step removed from that, it's a little of a bit of a safer space, if you will. And you're not going to be so down on them.
All right. Well,
So to all the grandparents out there, you
Yeah.
have a big role to play.
Yeah, thank you. So again, another theme of the many questions that came forward, how can parents partner with the Irvine Unified School District? As what you've all shared, they're getting a sense that we don't quite understand what might be happening. How can they reach out to all of you for some guidance and direction?
I appreciate the use of the word partner, because that is such a great definition of what it is. It truly is a partnership. And when parents want to kind of know how their kids are doing, I would say try and reach out to the parent or the teacher first. The teacher, whether it's one teacher or multiple teachers as they get into the secondary level, they see your student and your child for a long period of time a day. And so they have very valuable insight and would be able to share information. And that's what it's all about, is having as much information as possible so that you can help your student problem solve. You can help understand the experience of your student. And also knowing what the resources are available at the school site. So know whether or not they have school counselors, how many school counselors, whether it's a elementary resource counselor or mental health specialist. Know some of the activities that are going on at the school site so you can find and understand different ways that you may be able to help your student get connected. And it's always about that open and honest and consistent communication with the school. It could be your student may have their trusted adult, or the person that they're connected with may be an office staff. It may be a custodian. It may be an instructional aide. And really leaning in and staying curious about who are those trusted adults, and then reaching out and opening that communication. And as we know things that they're worried about or they're concerned about, it's the two entities talking so that the student knows from the school site to the home, they know that they're having those conversations and they can go to either side and get help. Reaching out, communicating, communicate, communicate, communicate.
Yeah, and we got some new questions that just came forward. And I think, Dr. Blakely, where should the parents go first? It sounds like reach out to the teachers. When you're not sure where to go, something's going on, teachers.
Start there.
Teachers
Yes.
is so. I think that's a good place to start, and then the teacher can maybe help guide, where to go from there, or the severity, the concern of what they're hearing. Okay, very excellent. Then there were a lot of specific themes in areas that really, were quite, uniform in many of the questions that came forward from our parents in Irvine. One was social media. The role of social media, how our children are using it, how it's impacting their well-being, how as parents can we engage, monitor, maybe share concerns, understand social media. So I'd like to throw that out to maybe Dr. Joshi, Dr. Hayashida, the role of social media in mental health.
So I'm very tempted to actually badmouth social media, but it's not all bad. So they are both positive. Anything in moderation is okay. And then I think it also depends on the developmental age of the child. So for example, the American Academy of Pediatrics has really come out quite vociferously about no TV and media under the age of 2. And that has been the stance of the American Academy of Pediatrics for some time now. On the other hand, social media children feel connected. It's a way to kind of exchange ideas, be supportive of each other. So there are lots of positives. The issue is when it goes to the dark side. And by that I mean the material that they can access, the amount of time that they spend. And we're seeing more and more children who are having a lot of sleep problems. And access to media, social media, late into the evening and at nighttime is really impacting their sleep cycles. So some, like I said, anything in moderation and monitoring, developmentally okay monitoring, I think is important. So, and some of our kids who never used to have friends before are able to connect through social media. And then there are others, of course, who are using it in negative ways, such as cyberbullying, and that's a problem in itself. We can talk about that, but it's the kind of the middle ground. They're positive to social media. I think a good conversation with your child is important. This is what you can gain by it, but here are the pitfalls. And I think an open conversation is a useful one. And get their buy-in. It's like, what do you think? Rather than just we dictating the rules.
Yeah, I like that. Get their buy-in. What do they see as the roles and the concerns? Any other thoughts about social media and what you've seen at the school level or?
I have a pretty firm stance on it, and I think in terms of relying or allowing our students to have boundaries or know when to stop is very difficult, because we've seen those documentaries where we hear they've been designed by psychologists to be very addictive. And so I think it's sometimes like putting a piece of cake in a child's hand and saying don't eat it. It's just a little too tempting. And in my former role as a principal, I had a lot of conversations with elementary parents whose 3rd graders, 4th graders were on TikTok and Instagram. And when we broached the idea of perhaps having boundaries, keep it in a common area, charge it at night, even in your room at night after a certain hour, it was a little daunting because they knew there would be a battle involved. It would be met with resistance. And I think as a parent, it's one of the more unpleasant areas to have to put boundaries on all sorts of things, right? But it's really worth it, because you're really protecting them until they have a bit more perspective, because at that age they're very impressionable and we don't exactly know what's involved. And, you know, I hear about the things that students making relationships with people in other countries, other states, and when their school counselors, these are like high schoolers, saying, well, you don't really know them. They insist, I know this person and they care for me, but they don't really know. And so I think it's also a matter of having conversations with things about strangers on the internet, about safety and protecting yourself and your image in terms of what you photograph and videotape. And it's not putting the ideas into their minds, because trust me, they're seeing it if they have access to social media accounts, but to be the person who's giving them that advice. You know, what I say about all sorts of developmental conversations, they'll remember the first thing they hear about something. And so as a parent, you want to be the first one to give them the voice of reason and to tell them what's true. And so I really believe strongly in having very proactive conversations about topics so they're not hearing misinformation from somewhere else.
That's very nice to hear. I like that word, proactive. That, and then along, you know, with social media being an area of many questions coming forward, bullying, it's a broad concept, but it's a common occurrence that we see regularly. Dr. Joshi would.
You know,
would
we are
like to
seeing,
share?
I mean, it's just amazing how it has just mushroomed, you know, the social media and the use of bullying. It's painful. You know, some of the stories that our patients and young people tell us, you know, what's happening. And if you're already vulnerable, then this is really going to get to you. And, you know, we can't control everyone and what they post and what they say about any particular person. And so then it again behooves, you know, how do you stay away from it? And how do you kind of help the young person build a sense of self, that they're really not relying on what other people think of you. And so it takes many levels, but it's become a huge problem. And lots of our patients are so affected by it, and young people. And again, it's the vulnerable who are more affected than the ones who have a sense of self, but no one is immune to it.
Would there be a broad definition of what bullying is? I think all of us have a concept in our mind.
You know, it's just saying, you know, passing negative comments, and everyone is seeing it, whether it's on the way you look, the way you act, you know, rumors about you, which may or may not be true. It's very painful stuff. It really is. You just have to, I don't want, some of it is even unmentionable.
And from the school perspective, there's a difference between saying things that are unkind or, you know, not being nice, and the definition of bullying is it's pervasive, or it is so severe that it one instance can be. And I think some of this is helping the students and families understand that we are here to help with interpersonal conflict, and to if they will let us know when things are happening in the moment or just one time, it helps us give the opportunity to resolve the conflict or help students problem solve so that they can solve their problems. If they don't say something and it continues and then it escalates and it keeps going, which would be the definition of bullying, it's really hard on the student, it's hard on the family, and it's more difficult for the school site. So if I could say anything, it would be that open and honest conversations and reaching out and having those trusted adults that are on school grounds so that they can let them know if there are unkind things being said or disrespectful things being said, that we can address it while it's small, rather than if it continues and truly turns into that true definition of bullying, which is that pervasive, repeated acts over time.
And it's interesting when you get to know students who are being unkind or are repeatedly bullying other students. Like, let's say there's a perceived power imbalance, and they're taking advantage of that power imbalance and tending to target certain students. There's instances of that, unfortunately. No one should have to go through that, and it can be very harmful. But when you look at the students who are engaging in that hurtful behavior, they often have needs that are unmet themselves. And so there's both that kind of school disciplinary response as well as that response of what are these students telling us by engaging in this behavior? How do we both respond to students who have been harmed? And then how do we support those students who are doing the harming so that they are more empathetic? So they're under, because a lot of them want good relationships. Every single student I know wants good friends.
Yeah.
And so how do we turn that negative behavior that's reinforcing these negative outcomes to engaging in more pro-social behavior so that they're garnering friends, able to be self-aware. These are the competencies of social-emotional learning, that self-awareness of how am I acting, how is it impacting others, how am I being perceived by others, because sometimes students don't even know that they're being unkind or so hurtful. Often, especially like in those late middle school years where they aren't so self-aware, and then they're acting out, but they don't realize the impact it's having on others. So a lot of what educators, counselors are doing in the classroom besides academic content, academic skills like how to study, how to manage your time, are some behavioral skills as well, you know, waiting your turn, being a good friend. We actually have listening and speaking standards in our curriculum so that you are listening to someone first and then building upon their ideas. And then along with that self-awareness is that self-management piece. What do you do with these feelings? If you're outwardly angry all the time, what else could it be? Is it sadness? Is it frustration? Is it something else? And are there more positive coping skills that you're utilizing so that you're not just outwardly doing something that's more negative? And so that's a lot of what we're doing. If you hear about social emotional learning in schools, it's really rooted in the desire to help students have more pro-social relationships, be able to make responsible decisions, and just even if they're feeling stress and related to the academic realm, are they able to access good coping skills for when they're stressed, acknowledge when they're stressed, and then access a good productive coping skill so that they're able to persevere through a difficult time and then see on the other side of that a positive outcome. Like, that really worked for me, I'm going to keep doing that.
I think you raise an excellent point because all the research has shown that perpetrators of bullying are victims themselves of having been bullied. Now, as a clinician, we don't see that because we don't know the bully, we know the person, the youngster in front of us, but at a school level, you probably have a better sense of the perpetrators of bullying. So they are vulnerable as well, and perhaps figuring out a way to reach out to them as well.
And I want to add, because I know there's a concern from parents about their children being bullied, is that we take that very seriously in our schools as well. And a consequence at a school, there may be a punitive aspect, but very much aligned with like something that may be more disciplinary, is the idea of how do we support these students so they make better choices in the future.
Excellent. That's really nice. I like, you know, keeps resonating in my mind, Sunny, that word proactive. You know, I could picture when you may have no sense of what might be going on at school, the demeanor of your child as well, but proactively ask. I might have accidentally pressed the. Proactively ask your student, your child, you know, what's going on. You know, are there any relationships or, you know, friendships that you're worried about? Just, you know, be proactive and set that table. Ignore the back of the slide. I pressed the keyboard. There we go. Okay. Now, that's sort of lots of questions have come in with what, to me, is almost the norm in elementary and secondary school today, stress and anxiety. That seems to, you know, every child experiences it in some ways. You know, how do we help our kids with just that broad concept, the stress, anxiety, that they're inevitably feeling, even though they may say everything is great? We know right under the surface, academic, social, the challenges of the world, you know, their own personal safety of where will this, you know, going on to college, and then beyond college, just, you know, how can we help our children with stress and anxiety?
I'll start.
Please, yeah.
You know, again, everything needs to be age appropriate, but you can teach young children how to breathe. And you'd be surprised that they'll open their eyes and they feel better afterwards, right? And so you don't have to teach them the full, or we're gonna do some yoga, we're doing some meditation or whatever, but 10 seconds of breathing, I think is often really helpful for students. And as they get older, they can add different mindfulness practices. We learn to appreciate the here and now. This time is going to pass quickly for them. It feels like, you know, every day feels like a year sometimes, but with the, you know, the years will start to rack up and they'll start to understand that this moment right now with this play that's happening or prom or whatever is a really beautiful, precious moment that's there to savor. I think it's important to teach children and young people other kinds of coping skills, right? Exercise as a really important way to discharge stress, right? Social relationships, all the things that you and I do to move, to have coffee, not coffee, but you know, maybe water with a friend. You know, that these are all things that are going to help them. I can't tell you how many times I've sat across from a college-age young person and said, what do you like to do for fun? And they look at you with a blank face sometimes because it's been AP classes, and I like to, you know, I like volunteering, and I like this, and I like that, and there's lots of wonderful things that you can get from volunteering, but it's because it makes you feel good, not just because you're trying to put it on a college application. So teaching students different kinds of coping skills, I think, is one way that we can help them deal with stress.
You know, I have a joke with my patients. I have them have enough number of coping skills as the age. So if you're a 5-year-old, you need 5 coping skills. If you're 17, you need 17. It's just a way, you know, to get them to think about different ways to cope.
And any other thoughts from the school district end?
I would say there's a lot of very busy students in our district, a lot of very positive activities they often participate in, and maybe taking a look at how much just downtime and unstructured time they might have in their schedule to allow them to decompress. I know it feels like you have to do all of those things in order to be competitive for college, and I think our high school counselors do an amazing job in our district of encouraging that balance of not stacking too many AP classes, of not playing too many sports and clubs, and really just encouraging students to say it's going to be okay. And I firmly believe that too, both as an educator and as a parent. Their potential and what they're going to do is, and I believe it even more, it might sound really basic, but they're going to succeed regardless of what school they end up if they have those great puzzle pieces in place. And I worry about, because that is also the profile of some of the students that we get concerned about, is we talked about internalizers and externalizers. Sometimes we see those students who have everything on paper going for them. They are club president, varsity athlete, many challenging courses, and they seem to have a lot of friends. And so on the surface, no red flags. But then sometimes it will come to a breaking point where it's just too much to handle, and those are the students that I worry about just as much as those students who have multiple more apparent red flags. And so I think it's worth doing those check-ins to evaluate, can we take something off your plate even? Because if you don't have time to do your coping skills, then I don't know how much good they'll do. And so it's hard in a district that is high achieving like Irvine to put that into balance, but I encourage it.
Yeah.
I always use the analogy of the plate. It's we all can handle a certain size of a plate, and a plate can only fit so many things. Is anything spilling over? And then you ask the child, is there anything you can take off of this plate? You know, so you kind of make them part of that conversation.
I think we need to model that too, because I'm just thinking about myself as you said that. I'm like, nope, not one thing I can take off my plate. But if I model that, I think that's the most powerful thing we can do with our students, and be intentional, and then maybe focus on them because we are busy as well. And so if we can model that, then and model many other things too,
But
talking about
sometimes
our feelings.
you know, the pressure comes from the parents. The child may want to take something off, but the pressure they feel, even if the parents don't say anything, they feel it.
Yeah.
And when you ask the child, is the pressure coming from your parents, yourself, both? And they'll usually say both. You know,
And their
it's-
peers, they talk, even third graders will talk about how they go to tutoring and things. They hear it from their friends as well.
Yeah.
So it's hard to go against that flow.
Yeah, good point. Yeah, I'm sure all of us as parents, when our children are facing adversity or some pain, or they weren't able to achieve what they were striving for, be it a grade or making a sports team or a club or a particular college, we feel for them.
Yeah.
But, as the saying goes, you really grow from your failures. These aren't failures, but when you don't quite get what you want, what you learn there will probably be far more important than the successes. So, but it's not easy as a parent
Yeah.
seeing our kids
It
go
is.
through that, and I can appreciate that. So, well, great. Now there were some really specific questions that I think are fun questions. One was, is a cell phone required in high school? You
So I'm
can
having
take that
this-
question anywhere you want.
I'm having this argument with my high school grandkids. And they say, so their claim is that this is the way they stay in touch with their friends, and one of them is being picked up after a sport, and they need to be able to get in touch with their parents. I've come to believe they probably do. It depends how you use it. Middle school is a different issue.
Yeah.
That's just my take.
I will say every student is issued a Chromebook in high school. So in terms of accessing their course content pages through Canvas or Aries, they do have a device that
Oh, they
is
do have a
district
device,
issued.
yeah.
So they could do that. I don't know what kind of phones. Maybe, we joke that kids can have those clamshells that aren't smart devices.
Right.
And so I don't know, I think there are some young adults to the Gen Zers who want the analog experience, but I think that's
And
still
parents
very
would
much a
say-
parenting decision.
And parents would say they know how to track their kids if they had a phone. They know where they are at any time.
Great.
So,
And I think you had an answer earlier, which is some things in moderation. There's something that you can take along with that with the phone is there may be some function and some benefit to both the student and the parent if there's boundaries and there's moderation and knowing the time and the place for using the phone. Because I feel like in some respects that is an automatic definite a power struggle between a parent and a student. So if you can find and work with the student on how does the student own ownership, when is it appropriate to use, how is it being used, and both having that agreement and potentially having a time and a place that it is put away, knowing the class rules, and being able to respect those, that may be more of a win-win in finding out how it can benefit both the student and the parent and the school in that relationship.
and in some states, the kids start driving at 16 or 17.
16.
And so I think parents would feel safer if they had, so
absolutely.
it depends. Yeah.
But I want to imagine a scenario where someone says, no phones until you're 16 or 17, and then phones. And so part of what's really useful is gradually, as you're saying, building responsibility. When you go from zero to everything, you don't really learn how to kind of pace your usage or whatever. And so some carefully monitored cell phone activity, I think, is reasonable. Unless they really don't know what to do.
I'm going to get a little bit more specific. I would recommend parental controls,
Absolutely.
maybe until they pay for their own phone. Even controlling whether they can download whatever apps they want. This is kind of going back into my principal mode. And there's our Irvine Police Department has some great digital citizenship presentations. Sites have invited these police sergeants and officers to come and give talks about the current dangers and what they're seeing from a law enforcement perspective around what minors are engaging in terms of cell phone use and social media. And on the flip side of that, when you talk to them as individuals and what they do with their children, they're often the most strict because they know the reality of what's out there. So I would heavily recommend just the parents staying very in tune with what is being done, and if anything, like having those parental controls and having control over what it is that their students are doing. It's hard, I know, as they get older and there's passwords and certain accounts. They might have a parent-facing Instagram account and then the other account. But as much as you can, and that goes back to knowing who their friends are and all those good things.
Okay. I'm going to try to combine 3 questions into one, so bear with me. But I do think this is an important, as we're coming toward the end, that will somewhat summarize what are some next steps. We've all talked about reaching out to the teachers first, as a parent, as a student, as a friend, if you're observing something. As the teacher is approached and receives information and then maybe talks to other staff at the school, the more professional staff that have more expertise in mental health. What happens next? Is that information confidential? The child and the school? Do parents have access to that? And that's a theme that's always you're going to see all the time, that they're worried about if their parents find out about what they're sharing. Just the courage of approaching and sharing is a great first step, but then what goes next? And then if it's felt that professional help is actually needed, some parents shared the challenges of accessing professional help, based on insurance, and so forth, availability and so forth. It's a big question, but now that the teacher has gotten involved and maybe the school's counseling services, confidentiality, how do parents get, that information, and where do they get treatment that may be beyond the scope of the school?
It's a complex answer to the question. We always hope that there is, again, the partnership with the student and the parent and the school. Students are afforded confidentiality based on age, and so they are able to share information, and then the school site will always do our best to say how can we best support and serve the student. And so it's a case-by-case basis, and we have to respect the student's ability to share information and find a treatment option or support system that supports them first, and then how they're communicating with their family. We would always hope that the parents are part of that communication and that support. So that's kind of as simple as I can get from the school perspective. With respect to treatment, we know that after the pandemic, finding support has been difficult. And that's why we have used, and we use Care Solace, which is that third party, the warm handoff, when we see that there's a need, whether it's individual student or student with family or parents wanting that support. And we do know that some of that has been virtual, and some of it may take some time. And we're doing our best to find as many resources and options as possible to connect students with those resources and families as well. We do have the Family Resource Center, so that is if the school recognizes that there is some support that may be needed. We do have mental health specialists that can see the student and the family for a little bit longer term that may be outside of the school day, but is not exceptionally long term. And so we do have that resource, and we are truly hoping that as mental health specialists and services become available in the community, that we are also that resource link that can say, here's what we can provide within school, and then how do we help them find supports outside of school.
Any thoughts, Dr. Hayashida?
Yeah.
Dr.
No, it's
Jones?
just a challenge, I mean, we have more needs than we have resources. And so that's kind of been an ongoing challenge. And
The first place to start is if you have insurance, take a look at the insurance. I understand it's often difficult, there's a long line. And so but if you get on the list, you're on the list, right? In the meantime, there could be other things that could be really useful for your child. I think there was a question or two about children with learning disabilities, ADHD, where can I find like something to help my child with executive functioning? That may be a coach and not a therapist, right? Coaches can do lots of things that more cheaply, and it doesn't require talk therapy, right? But someone to help get my kid is upset because the homework is disappearing somehow between school and home, and there could be a coach that could help them think that through. So for mental health issues, right, your child is sleeping too much or eating too much or just sadness or talking about harming themselves, you need to go through perhaps your insurance or through these resources. But there are lots of other things that you could do for different kinds of
I think the other thing I want to add is that there are more and more pediatricians, and I think it's a bit of a mandate in the country, but pediatricians being trained or family physicians being trained in kind of the more basic mental health services. And we have a program at UCI, the TNT program that Dr. Bera is quite involved in, where there's a program set up to educate primary care physicians, nurse practitioners, and pediatricians about sort of ground level ADHD, if you will, mild depressions, mild anxiety, so at least you can get some services. And most pediatric offices will have a psychologist or a social worker attached to their practices. And so just for families to know that.
That's a great tip, to have them start with their pediatrician, because they can screen for other health indicators as well.
Yeah. And I think it's a requirement, Dr. Bera, that every pediatrician, every new patient needs to be screened for depression. So, it's just a natural.
Yeah. I mean, as the stigma of mental illness is somewhat being broken, the evaluations, assessments will go well beyond just pure mental health specialists.
Right.
We'll never have enough mental health specialists to treat children, adolescents, adults with, conditions that need
And
treatment.
parents may feel more comfortable because of the stigma issue, it still lingers, unfortunately, yeah.
Okay, well, this was wonderful. I would like to now turn it over to Katie McEwen, who really is the driving force with regard to putting this evening together. And my hope is, Katie, that this will continue to be a regular forum between UCI and IUSD. Now, Katie was elected to the Irvine Unified School Board in November of 2022, and she's serving her first term. And she's been teaching in the Irvine Unified School District for many, many years. Northwood, volunteer work at Meadow Park, South Lake, Woodbridge, 3 children that have attended. But Katie, closure is yours.
Thank you. I'd like to thank our esteemed moderator and expert panelists for addressing the issues that we parents face when trying to help our kids deal with mental health issues. And a big thank you to UCI for hosting the forum in this wonderful venue. Certainly nothing is more important than the health and well-being of our children, especially coming out of the pandemic. And student mental health is a concern and priority for me, not just as an IUSD board member, but also as a mom to 3 teenagers, 2 of whom are current high school students in IUSD. I appreciate our IUSD and UCI leaders for sharing their insights and hope that you have all learned something helpful and some steps that you can take with you to support your children's mental health. I'd also like to remind parents that IUSD offers a robust array of school-based mental health and wellness services and resources to students and families provided by counselors and mental health professionals. We encourage you to visit our IUSD website, which will be displayed on the closing slide, to learn more about these resources and how they can benefit your child's mental well-being. Finally, I want to encourage all of you to stay vigilant in your efforts to communicate with your child directly and stay in touch with what they are doing, who their friends are, and what their online habits are. We are so much better when we stick together as a community. So let's continue the conversation and support each other. As Arthur Ashe once said, start where you are, use what you have, do what you can. Thank you all for joining us today, and we wish you the best in supporting your children's mental health.